Welcome to the Deep Dive. Today, we're going to explore 5 concepts that are really key for new sterile processing leaders who are, trying to build amazing teams and departments.
That's right.
Yeah, so to get into all this, we've got excerpts from some really essential regulatory guides like the AAMI standards, ST79 and ST91.
Oh, yeah, those are the big ones.
Exactly. We've also got some D&V accreditation standards, an instrument manufacturer guide, and even a Joint Commission booster pack, all about high-level disinfection.
It's like we're putting together this awesome sterile processing toolkit, with insights from all the top experts and stuff.
Yeah, that's a great way to put it. And we're going to break it all down to help you, really up your leadership game.
Yeah, definitely.
So you ready to jump into our first concept?
Let's do it.
All right, so first up is setting the stage for success. And I don't mean like a big fancy Broadway show.
Right.
We're talking about, the physical layout and the environment of your sterile processing department.
The place where the magic happens.
Right. And AMI ST79, which is like, the guide for best practices in sterile processing, has a lot to say about this.
For sure.
It's like the blueprint for creating a space that, minimizes those contamination risks, makes things super efficient, and keeps the whole team safe.
And it gets into some surprisingly specific details.
Yeah.
Did you know that dedicated hand washing stations are a must-have?
Oh, for sure.
And not just any old sink either. AAMI ST79 says you got to have backup systems in place just in case, the power goes out.
Wow.
That way hand hygiene is never compromised, even in the dark.
Yeah, that's like next level planning right there.
Absolutely. It's like they're saying that hand hygiene is the superhero of the whole sterile processing operation, always ready to fight off those infectious villains.
I love that analogy.
Yeah.
And there's even more. AMI ST79 also talks about how important it is to have the right lighting levels.
That makes sense.
Yeah, and get this, the recommendations actually change based on how old the workers are. Yeah. Apparently, as we get older, we need more light to see clearly.
Huh. Who knew good lighting could be an age-specific thing?
I know, right? So no more, dimly lit sterile processing departments.
No way.
We gotta have these bright and well-lit spaces so that everyone can see what they're doing.
Exactly. And to keep our sterile processing superheroes, comfy and injury-free during those long shifts, AMI ST79 recommends using anti-fatigue mats.
Oh, that's a good idea.
Happy feet, happy staff.
For sure. It's all about creating a work environment where people can actually thrive. And, AMI ST79 doesn't just talk about comfort. It also goes into some pretty serious stuff like prion contamination.
Ooh, that's scary.
Yeah, and they even have specific recommendations for handling instruments that might have come into contact with CJD.
Oh, wow. Prions are like the supervillains of the microbial world, incredibly hard to get rid of.
They are. So we got to be ready to handle those really extreme situations.
Definitely preparedness is key.
Absolutely. And speaking of protection, both AMI ST79 and the DNV standards, which are all about accreditation and quality improvement. Both of them say that it's really important to have a controlled storage environment for your sterile instruments.
Oh, that makes sense.
Yeah, it's like you're protecting these super valuable crown jewels.
Right.
Those carefully sterilized instruments need to be kept in a safe and stable place to make sure that they stay sterile.
You don't want to undo all that hard work.
Right. We're talking about, having the temperature and the humidity just right and protecting them from any kind of damage.
It's like creating a sterile sanctuary for those instruments where they can rest until they're needed.
I like that. And not only do those instruments need protection, so does our sterile processing team.
Of course.
AMI ST79 even gets into the, wardrobe.
Oh, really?
Yeah, they talk about the importance of having the right attire for sterile processing personnel.
It's like a special uniform.
Exactly. Designed to, really minimize any chance of contamination.
Interesting. So no flowing capes or loose-fitting clothes allowed?
Right. And jewelry also gets a special mention. There's some pretty strict rules to prevent anything from accidentally falling into, a tray of instruments.
That makes sense.
Yeah. And they also talk about making sure that all those garments are laundered in a controlled way so that those uniforms are just as clean as the instruments they're handling.
It's like we're putting on a sterile processing fashion show with every detail carefully thought out.
Exactly.
So we've set the stage,
Yeah.
With a safe and efficient workspace.
Yeah.
Now let's move on to concept number 2, which is all about building your A-team.
Okay, so now we're moving from the environment to the people.
Exactly. And this is where DNV and AAMI ST91 really come into play.
Got it.
They focus on, personnel qualifications, making sure everyone's properly trained.
So it's like building a team of sterile processing all-stars.
Precisely. Just like any high-performing team, sterile processing needs skilled and dedicated people who are really committed to excellence. And to make sure that everyone on your team is playing at that all-star level DNV standards, say that you need to have very clear qualification guidelines.
Okay.
They actually require not just initial competency evaluations, but also annual ones that objectively measure everyone's skills.
Wow. So no coasting on past achievements.
Nope. Everyone has to prove that they're still proficient year after year.
It's like having a yearly skills assessment,
Yeah.
making sure that everyone is keeping their sterile processing superpowers sharp.
That's a great way to put it. And this rigorous training and competency verification isn't just for, the people working on the front lines.
Right.
It's for everyone involved in sterile processing, from technicians to managers.
Mhm.
AAMI ST91 is super clear about that. Everyone needs to be on the same page when it comes to, best practices.
So it's really about building that culture of excellence where everyone is committed to upholding those high standards.
Absolutely.
And speaking of standards, AMI ST91 gets into the specifics about attire and hygiene. And this is where things get really interesting.
Oh, yeah. Tell me more.
So AMI ST91 lays it all out. Specific guidelines for nail care, jewelry, hand hygiene, the whole 9 yards.
Yeah, okay.
For example, artificial nails.
Yeah.
Strictly prohibited.
Oh, wow.
Yeah, they can harbor bacteria and, compromise hand hygiene.
That makes sense.
And jewelry, especially anything that dangles or is loose, that's restricted too.
To minimize contamination risks.
Right. And of course, we can't forget about meticulous hand hygiene.
Hmm.
Following those CDC or WHO guidelines.
That's a must-have.
Definitely. It's fascinating how these little details can have such a big impact on preventing infections.
It's all connected.
It is. And I've also heard that there's some debate going on about nail polish in sterile processing.
Oh, yeah, that's a hot topic.
It is. So has AMI ST91 weighed in on that yet?
Well, AMI ST91 acknowledges the debate, but they basically say it's up to each facility to decide.
Oh, so they don't take a strong stance.
Not really. They say that facilities should develop their own policies based on their own risk assessments.
Okay.
So some places might completely ban nail polish, while others might allow it as long as it's a specific type or color and in good condition.
Got it. So it's one of those gray areas where leaders need to really stay up to date on all the latest evidence and make decisions that are right for their situation.
Exactly.
It's a good reminder that sterile processing is always changing.
Oh, yeah.
Those guidelines and best practices are constantly evolving.
For sure. So let's shift gears now and get into the heart of sterile processing.
Okay.
That process of taking instruments from soiled to sterile.
That's the magic right there.
It is. It's like taking those instruments on a journey from grubby to gleaming.
I love that analogy. So how do we make that happen?
Well, our guide for this journey is the Spalding classification system.
Okay, I've heard of that.
Yeah, this system helps us decide what level of disinfection or sterilization is right for each medical device.
Got it. So it's like sorting your laundry.
Exactly. Some items just need a quick wash, while others need a deep clean.
So how does that laundry analogy work for medical instruments?
Okay, so with the Spalding system, we have 3 categories:
Right.
critical, semi-critical, and non-critical.
Got it.
Now, the critical items are things like surgical instruments that actually penetrate sterile tissues or the bloodstream.
Okay.
These need the most intense level of sterilization, to eliminate all forms of microbial life, even those super tough bacterial spores.
So it's like using the highest heat setting on your dryer to make sure those surgical instruments are totally bone dry and free of anything that could cause problems.
Precisely. Then we have our semi-critical items, things like endoscopes and laryngoscope blades.
Uh-huh.
These come into contact with mucous membranes,
Okay.
but they don't usually penetrate sterile tissues.
Mhm.
So these need what we call high-level disinfection.
So not quite as intense as sterilization.
Right. It kills most, but not necessarily all bacterial spores.
It's more like a warm wash cycle with a good amount of disinfectant.
Exactly. And finally, we have our non-critical items, things like blood pressure cuffs and stethoscopes.
Right.
These only touch intact skin.
Got it.
So they just need a good cleaning with a low-level disinfectant.
So that's like a gentle wash cycle with a mild detergent. Enough to get rid of dirt and grime, but not necessarily kill every single microbe.
You got it. But even with this handy-dandy classification system, the most important guide is always the manufacturer's instructions for use, what we call the IFU.
Right, the IFU?
Yes, the IFU is like the instruction manual for each instrument, you know?
Yeah.
It tells you exactly what cleaning agents to use, what disinfection methods to use, sterilization parameters, all that good stuff.
So no experimenting with your own concoction.
Nope, we got to treat those IFUs like they're sacred texts and follow them to the letter.
Absolutely. It's all about making sure we're using the right tools and techniques for each instrument so we can be sure that they're sterile.
That's the goal. And speaking of sterilization, steam sterilization is like the gold standard for most instruments.
It is. And the Joint Commission Booster Pack, which talks all about high-level disinfection, highlights steam sterilization as the preferred method. But they also mention different types of steam sterilization cycles. Can you break those down for us?
Of course. So you have gravity displacement,
Okay.
where steam goes into the chamber and forces the air out. And then you have dynamic air removal, where a vacuum pump actively sucks the air out before the steam even gets in there.
So it's like choosing between a regular oven and a convection oven.
Exactly. They both cook the food, but one uses forced air circulation to heat things more evenly.
Got it. So it's all about how the air is removed before the steam does its job.
Right. And while steam is definitely the most common way to sterilize things, there are some other methods out there.
Like what?
Well, AAMIST91 also mentions things like ethylene oxide gas sterilization and hydrogen peroxide gas plasma sterilization.
Okay.
These are usually used for instruments that are sensitive to heat, the ones that can't handle those high steam temperatures.
So it's like having special tools for those delicate instruments.
Exactly.
So we've got all this fancy sterilization technology, but how do we actually know that it's working?
That's the million-dollar question.
Right? How do we make sure that our processes are actually producing sterile instruments every single time?
That's where our fourth concept comes in, monitoring for excellence.
Okay, I'm intrigued. We've got the right space, the right team, the right processes, but it sounds like that's not enough.
It's a good foundation, but we need to take it a step further.
So what else do we need to reach that next level of, sterile processing excellence?
Well, we're going to talk all about that in our next segment, so stay tuned. It's all about quality control and improvement,
Okay, so like making sure we're dotting our I's and crossing our T's.
Exactly. We need to have really robust measures in place to make sure that we are consistently hitting those high standards for sterility.
So it's like we're building this elite squad of sterile processing inspectors.
Yeah.
Constantly on the lookout for any, weaknesses on our defenses.
That's a great way to put it. It's all about being proactive and not just waiting for things to go wrong.
Right. So what are some of the key things we should be doing to monitor our processes effectively?
Well, the Joint Commission Booster Pack and AMI ST79 give some great guidance on this. They recommend a multi-pronged approach.
So like a Swiss Army knife of monitoring techniques.
Exactly. We need to be attacking this from all angles.
Okay, so what are some of the specific strategies they recommend?
Well, one big one is regular testing of all our mechanical cleaning equipment.
So like those ultrasonic cleaners and washer disinfectors?
Yep, got to make sure those machines are doing their job, getting rid of all that debris and bioburden.
So it's like giving them a regular checkup.
Exactly. We want to make sure they're running smoothly and efficiently.
And how do we do that?
Well, there are specific verification tests that we can use.
Okay, so we're not just eyeballing it.
No, we need objective data to prove that our equipment is performing as it should.
Got it. So that's one part of the monitoring puzzle. What else is there?
Well, another really important thing is using chemical indicators and biological indicators in every single sterilization load.
Oh yeah, those CIs and BIs. So they're like little spies that tell us what's going on inside the sterilizer.
That's one way to think about it.
So how do they work?
Well, the chemical indicators, they change color when they've been exposed to certain sterilization parameters like temperature and time.
So they're like a visual check.
Right. They give us a quick and easy way to make sure that the cycle reached the right conditions.
Got it. And what about the biological indicators?
Those are the heavy hitters. They actually contain those super tough bacterial spores that we talked about earlier.
Oh yeah, the ones that are so hard to kill.
Yep. And if those spores are killed during the sterilization cycle, then we can be pretty darn sure that everything else is dead too.
So it's like the ultimate test.
It is. It gives us that extra level of confidence that our sterilization process is working as intended.
That's reassuring. And it sounds like documentation is also a big part of monitoring for excellence.
Absolutely. Meticulous documentation is key.
Mm.
We need to keep detailed records of every single sterilization event.
So no scribbling notes on the back of a napkin.
No way. We need to be organized and thorough.
And what kind of information should we be recording?
We need to document things like the physical parameters of the cycle, like the temperature and pressure,
Huh?
the results of our CI and BI testing, the operator's ID, and any other relevant details.
So it's like creating a logbook for our sterilization spaceship, tracking every detail of our journey to sterility.
I love that analogy. It's a great way to think about it.
It helps to visualize the process. And speaking of organization, AAMI-ST79 talks about this concept of product families and master products for testing.
Oh, yeah, that's a really important concept.
So can you explain what that's all about?
Sure. So basically, instead of testing every single instrument individually, which would take forever, we group similar instruments into what we call product families.
Based on their design and complexity.
Exactly. And then from each family, we choose one representative instrument to be the master product.
So it's like choosing a champion from each instrument clan.
Yeah, and we carefully place our BIs and CIs on that master product and run it through a sterilization cycle.
Okay.
And if the master product passes the test, meaning the BIs are killed, then we can assume that all the other instruments in that family would also pass.
So it's like a shortcut, but a smart one.
Right. It allows us to be efficient with our testing without sacrificing accuracy.
I like it. So we've talked about the physical space, the team, and the technical processes.
Yep.
Now let's move on to our fifth and final concept.
Okay.
This one is all about the leader as a conduit for communication and collaboration.
This is where the human element really comes into play.
It does. So what does it actually mean for a sterile processing leader to be a conduit in this context?
Well, it means going beyond just managing tasks and processes. It's about building relationships, fostering teamwork, and making sure everyone is working together towards that shared goal of patient safety.
So it's like being the central hub of a communication network.
Precisely. Making sure that information is flowing smoothly and that everyone is on the same page.
And the DNV standards talk about this too, right?
They do. They specifically highlight the importance of communication between the Sterile Processing Department and the Infection Prevention and Control Committee, or IPCP.
So we need to be sharing information with them.
Absolutely. We need to keep them in the loop about any issues, trends, or concerns related to our sterilization processes.
So it's like we're all part of this bigger infection control task force.
Yeah.
Sharing intel and coordinating our efforts.
That's a great way to put it. And this collaborative spirit shouldn't stop at the departmental door.
Right.
AAMI ST91 talks about how important it is to create a culture of open communication within the sterile processing team itself.
So we need to be talking to each other.
More than just talking, we need to encourage feedback, address concerns, and resolve issues effectively.
And that's how we build a strong team.
Exactly. When everyone feels safe to speak up and share their ideas, that's when we can really achieve excellence. It's all about, creating that environment of trust and respect where people feel comfortable speaking up.
Right. Psychological safety.
Exactly. And that brings us to the end of our deep dive into these 5 key concepts for new sterile processing leaders.
It has been quite a journey.
It has.
Exploring all the ins and outs of, building those top-notch teams and departments.
We covered a lot of ground.
We did, starting with, setting up that well-designed and functional workspace.
The foundation.
Exactly. Then we talked about putting together a team of really qualified and competent people.
Our sterile processing all-stars.
Right. And then we got into the nitty-gritty of cleaning, disinfection, and sterilization.
Yeah.
Making sure we're following those IFUs and monitoring everything super carefully.
Can't forget about those IFUs.
Absolutely. And finally, we talked about how crucial communication and collaboration are for creating that culture of safety and continuous improvement.
It's all connected.
It really is. These 5 concepts all work together, to create this really strong and effective sterile processing operation.
Like a well-oiled machine.
Exactly. And as we wrap up this episode, I want to leave you with something to think about. What really resonated with you today? And what's one action you can take this week to actually put these concepts into practice and, really step up your leadership game in your sterile processing department?
That's a great question. I hope everyone takes some time to reflect on that.
Me too. It's been awesome diving deep with you.
Likewise, until next time.
Keep striving for excellence in everything you do and keep those instruments sparkling. Thanks for joining us on the Deep Dive.